Good morning. My name is Felicia McNeil. I am a student at Indiana State University in the LPN to BSN program. I'm in the Community Health Program 444, Dr. Lucky's class. So today I'm going to bring to you a serious topic. This is a public service announcement. So today we're going to talk about HPV. And the age range we're going to talk about is from 14 to 59 years of age. So this is just to inform the community. First, before we start, what I'm going to do is, if you click the link down below, please, it's down below. So you're going to see the pretest. So this test is just to test your knowledge and see how much you know about HPV. I'm not even going to tell you what it is yet, but I'm going to see if you know what it is. So this is the pamphlet right here that you're going to click in the link down below. And it has 10 multiple choice questions, 4 questions within each. Like number 1 has 4 questions through 10 has 4 questions. Also, you're going to choose A, B, C, or D. So you'll mark which one that you think is the correct answer. So I'm going to give you a few minutes and I'm going to come back and then we're going to have a conversation about HPV. Thank you. All right. Hope everyone did good on the pre-survey. So first, we're going to start off by talking about our objectives. Like, what are we going to discuss and what I want you to learn about this presentation. So first, what you should know about HPV, the Human Papillomavirus. That's the name of the virus. How is it spread? Are there health complications caused by HPV? Does HPV cause cancer? What can I do to avoid infection and common health problems? HPV infection in pregnancy. Is there a cure for HPV? Any health issues caused by HPV? And where can I get more information on this infection? That's what we're going to talk about today. All right. So HPV, Human Papillomavirus, is a sexually transmitted infection and is the most common STI, or better known as STD previously, and they changed it. So HPV is a virus that causes warts in the body. It can be on the arm, it can be on the hands, it can be on the penis, on the vagina, on the rectum as well. And there are over 100 different types of HPV. So not just 100. That's a lot, right? So how is the virus spread? So you can spread the HPV virus by coming in contact with someone sexually unprotected with vaginal sex, oral sex, or anal sex. Even if the person is not having an actual outbreak, you can still contract the virus. Are there any health complications that's caused by HPV? Yes. And this is where it gets very, 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 very important. HPV is an infectious infection that causes genital warts, cervical, and other types of cancer, and common warts as well. So the warts are flat looking. And so we'll pause right here. So if you look down below, you'll see a pamphlet in the section in a YouTube video. Mine is black and white for video purposes, but everything we're talking about is discussed in this pamphlet right here. It has the front and back here, and you can follow along if you want to click and open that up for me. And the back side with the information where to find more information if you have any additional questions after the presentation. So, genital warts generally appear in the genital area, are flat or large cauliflower shape. In the males, they can come in their testicles and it looks just like a bunch of cauliflower. So what we'll do is we'll draw it to see what it looks like. I'm not a good drawer, so you guys just bear with me. So if you've ever seen broccoli in cauliflower, it kind of looks like this with stems. It kind of looks just like this with stems in it. It's the same thing. That's what the man's testicles would look like if he test positive for HPV, that's what it could look like. So the next question is, can HPV cause cancer? Yes, it can. Not right away, but over some years, untreated, it can cause cancer. The most common type of cancer that it can cause is cervical cancer. And that's a big deal in women because it can affect sterility, whether you're trying to have kids or not. If you develop cervical cancer, you may end up having to have a hysterectomy as well. Vaginal cancer, men can have cancers on the penis, oropharyngeal cancer from oral sex. And it may be many years before it's even detected. And so also people with weak immune systems, it can also cause major issues in people that's immunocompromised, like your HIV patients, your patients with, let's say, Addison's disease, because they have a low immune system, even cancer. So what can you do to help prevent getting HPV? First of all, abstinence is the only way you can prevent from getting it and spreading it. But they have a vaccine, HPV vaccine, that you get, and this is what you use to pre-treat the medication. Even before you get it, you get this vaccine to prevent from exposing other people, and this helps you as well. So this is what you use. So how are you screened for cervical cancer? How are you screened for HPV? Well, the only way to be tested is through a pap smear. And so with this, they ask you that you keep the same partner. Don't use multiple partners. And if you do, make sure you use a latex condom or non-latex if you're allergic to it. Use dental dam if you're going to have oral sex. And we talked about it in some of my other previous videos. So can HPV affect pregnancy? Well, as far as right now, it's no research or evidence stating that it affects the fetus or goes across the placenta barrier. So, and we just talked about there is no cure for HPV. You can't cure it. You can only treat the symptoms that you have whenever you have it. So in women, this is important. This is why it's very important to get pap smears. So pre-cervical cancer screening is important, especially if you have not been vaccinated for HPV. It's very, 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 very important because these cells can actually multiply and turn into cervical cancer. So this is why it's very important to be treated and vaccinated. Most people can manage if treated early. So how long does it take to treat HPV? It takes 1 to 2 years to be free of the human papillomavirus. I know that is a long time, but that's how long it takes. And even in between that time, you can infect other people, which that's a big deal. You don't want to go around knowingly affecting other people. And we're doing this public service announcement so that way parents can let their children, or you can watch the video with them. I know sometimes in different areas of the world, some people may not feel comfortable talking about their children with this particular type of thing. And these videos you can just let them watch it and you watch it with them. That way, if they have any questions after, you'll be able to refer them to where can I get more information about HPV, which is an STD. So you can go to the CDC website, which we have one in Rockville, Maryland, and also in a American Sexual Health Association here. So these right here are great sources right here if you have any further questions. So I want to thank you guys for taking the time out to listen to this public service announcement. And here we're going to click the link down below and we're going to take the post test. This is just to see if you guys remember everything we talked about the HPV. And don't forget, men are the #1 carrier of HPV, not women. Women are easy to contract. Men are easy to give. So thank you so much. I hope this has been very helpful and keep following me. Thank you so much.